Good morning, it's Dr. James Nessing, your Macon, Georgia chiropractor. We're here this morning in the office and Mary's come in with some complaints of her neck and her shoulders. Tell me a little bit about what you're feeling and how long you've been feeling it lately. What's brought you in today?
Because I'm really sore and I can't hardly move my neck.
Really restricted?
Right, yes.
Okay. What's your pain number, you think?
4.
A 4. Okay. All right. So let's check you. Let's just see what's going on with it.
Okay.
Let's turn out to the very front. So everything's local to here.
Yes, sir.
So it starts in this area,
Yes, sir.
comes out this way.
Yes, sir.
No numbness or pain down your arms, correct?
No.
Okay. All right, so let's just check her and see what's going on today. I'm just going to palpate first. So that's pretty sore,
Right.
obviously.
Yes.
Some spasm there. Okay. You told me a while back that you had fallen on your outreached arms and stopped yourself,
Yes.
and that aggravated your neck at that time, right?
Yes.
Okay, same thing there. Let's see, lean your head down. Does that cause any extra pain or pulling on either side?
Just a little bit.
Okay.
Not pain.
All right, look up at the ceiling. All right, so when you get all the way to that point, that's limited, but does that cause extra pain on either side?
Just a little bit.
On the left or the right?
More on the left.
Okay. All right, we're gonna see how far you turn your head. You're gonna go to the right. Okay, so your chin goes to about here. Let's go to the left now. And that hurts
Yes.
to the left.
Yes.
Okay.
It's binding.
So when we lean you back on the left, that causes pain on this side?
Yes.
Does it
Yes.
stay local to your neck?
Yes.
Okay. So what that tells me, that's local joint pain when we compress. That's not a muscle. That's a joint problem. Turn it to the side. Do you have any pain on this side when we compress you?
Just a little discomfort, but not
Little
like the other
discomfort.
side.
Not so much.
No.
Okay. When I lift on your chin and neck, does that relieve any pain or feel good to anything?
Yeah, feels good.
Okay, so when we do distraction, that opens the joint space and that tells me that traction is going to be a helpful thing for her as far as treatment. Okay, so let's just go ahead and work on you a little bit. We're going to start out with some instrumentation adjusting. We're just going to glide. We're going to glide up the cervical facets. And we're going to start down low, about T3. Okay, how'd that feel that time?
It's,
It was okay?
yes.
It wasn't painful, was it?
No.
Okay. Let your head come down just a little bit. So this instrument is specifically designed to fit the cervical facet capsules on both sides. So this gives a micro motion to those joints, and it helps facilitate impulses up to the brain. It comes back down to the muscle spindles, and it helps relax the musculature. It also helps the movement of the spinal segments. And we're going to go ahead and just check this again. That's not quite as tender, I don't believe.
No.
The muscle's less on that side.
Right.
So I'm going to tap right over the level that you have restriction. So we're just going to lean to this side. We're just going to tap real gentle. Good. Okay, it's still pretty sore there.
Not as sore.
Okay. So that's about C5 level. Lean it this way. check the very upper part of your neck. All right, now we're going to check the lower part of your cervical and your upper thoracic. You got to bend to the left. And yeah. Okay. Let me get it down. And actually, that's a little better than it was a minute ago on the motion. But I'm just going to go ahead and tap on that in left lateral flexion. Just going to tap just like this. And we're going to check. We have that right there. You can feel that one restricted. So we're going to tap on that side. So I'm going to bend to the right. I'm also going to use a percussor on her to release some of the fascia. Fascia covers the muscle. It extends from the top of the head to the toes. Fascia can get restricted from trauma. It can shorten and have scar tissue. What the percussor does, it pumps at a high frequency and it releases that fascia. How's that feel?
Good.
Feels okay?
Yes.
You feel that all over your neck?
Yes. Down my arms.
You feel like a buzzing, you mean? Or
Yes.
a vibration?
Right.
Yeah.
And then you feel it in my legs too.
I'm just going to use this over the restriction of her upper thoracic, right over the T2 level. It's a little sensitive there.
Yeah.
You all right with that?
Mm-hmm.
Okay. Okay, I'm going to check that. All right, you move a little better than you did on the motion. Let me see you turn your head to the left. Turn your head about 5 degrees better on the rotation after that. That one's about the same. Does that pull a lot through here? You feel that pulling through here much or not really?
Not really.
Okay. All right, let's just check the upper neck again there. So since you had less pain with distraction, we're going to do a little traction on your neck, meaning just go ahead and lay back here.
Okay,
Yep,
face forward.
yep, on your back.
Oh,
Be
my
on your
back.
back. Okay, good. All right. So I'm just take my hands. We're just going to manually traction you. Does that feel all right?
Yep.
With her particular problem, she does have some thinning of the disc spaces of our lower cervical area. And this will open up the foramen to allow the nerves to come out into the shoulder musculature, out into our trapezius. I'm going to do a little manual long axis traction tug. So breathe through your nose and blow out through your nose. Let it stretch. Good. Do it again. Breathe in. Blow it out. Breathe in. Blow it out. Okay, good. I'm going to turn you out this way. Okay, so when I'm feeling your neck, I can tell at the very upper level here, you got some restriction, right?
Right.
At the very top here. So we're gonna adjust that on your stomach. So turn over on your stomach. It's the left side, so come down just a little bit to there. Okay. So this table is specifically designed to allow us to use the head drop piece. The restriction is right at the top of her skull, right at the top of her neck. We're just going to do a light traction drop. Let's see, make sure that's set right. Okay, that feels pretty good. So just let your shoulders relax. It's going to drop. There you go. Good. Same thing again. Relax. Good. Relax. I'm going to drop a little faster. Do that one more time. All right, awesome. All right, let's sit back up. I want to recheck all that. Okay. Let's see if that helped a little bit. All right, I think that moves better at the top.
Oh, yeah.
It feels
A
like
lot better.
a lot better.
Lot
Good bit
better.
difference.
Yep.
Now let's turn again. All right, so now you get like another 5 degrees of rotation
Yep.
after that. Upper cervical has about 50% of your range of motion of rotation. So when this doesn't glide properly, it's going to affect you in that way. It's going to make the muscles tighten up through those areas. Okay, so did that feel better?
Yes. Lot
Okay.
better.
All right. I'm Dr. James Nessing, your Macon, Georgia chiropractor. Thanks for watching today.